There are a lot of misconceptions about Parkinson's out there. I think one common thing that I see, Parkinson's can affect your facial expression. They call it masked faces, or sort of like a Parkinson's mask. And I think people often mistake that for depression. So the patient with Parkinson's might not smile as much or might not laugh as much. But that's not necessarily a reflection for how they're feeling on the inside, both for family members and doctors. When speaking with someone with Parkinson's, you don't want to make assumptions about what their mood is or how they're feeling. You have to make sure you're really asking, navigating, and digging at those feelings to try and get a good sense of where the patient stands. I would say one other misconception, sometimes as disease advances physically, patients can become very disabled, where they might be unable to ambulate or have lots of trouble walking with frequent falls. I think sometimes family members or even doctors might have a tendency to assume that patient is also very cognitively impaired, but those symptoms can be very different. So, sometimes a patient might have no cognitive symptoms at all, but they might just have trouble speaking and trouble walking. And you have to make sure when you're talking with someone in that form of Parkinson's that you're giving them the dignity they deserve, understand that they're completely with it often, and you have to make sure you're approaching them at their level.